My name is Navid Farahmand. I'm a board-certified anesthesiologist, and I have subspecialty training in interventional pain management. Patients come to see me for a variety of conditions, but at the end of the day, all of them have some degree of chronic debilitating pain. Oftentimes, they're looking for non-surgical treatment for their options, and when that's the case, I'm generally the one that you want to see. There's a lot of treatment options for people who have problems with the bulging disc, either in their neck or somewhere else in their spine. And obviously, there's a variety of treatment options available for that. On the conservative end, you can try things like physical therapy and chiropractic care and exercise. The more aggressive or extreme end of the scale is something like surgery when you've exhausted most of your conservative measures. What I define as what I can do is more treatment in the middle. Largely that involves injection therapy, where we're trying to essentially numb nerves or reduce inflammation on nerves to reduce pain. For example, I saw a gentleman who's probably in his early 50s. He was at home with his wife, and he was helping with some lifting around the home. I believe they were switching around some of the furniture arrangement in their home. And he stooped over acutely to pick up a couch, and he felt a sudden give in his back. His back went into spasm, and he crumbled to the floor, and he spent essentially the next 4 or 5 days at home resting. As the pain continued to get worse, he finally saw a doctor who had sent him to me for further evaluation. When he came to see me, he was bent over in pain. He had a lot of pain across the right side of his back and buttock, and described numbness and weakness going down the right leg. After further evaluation, we came to the conclusion that unfortunately the gentleman had ruptured or herniated a disc in his back. And that generally will cause some pressure on the nerves in the spine, and especially in the low back. People will have complaints of either a component of back pain, leg pain, or weakness, or a combination of the two. In terms of treatment for such problems, again, if it's a significant problem and the pain persists, perhaps surgery becomes a viable option. One of my jobs is to try and keep people away from the operating room and out of surgery. And can we minimize their pain complaints and restore their function with less invasive treatment? The goal of a cortisone or epidural injection is to reduce pain and inflammation over those nerves where they feel the disc rupture. And oftentimes when we're successful on that, the symptoms can be alleviated and the patients can resume normal activity. It's really rewarding to see a patient go from start to finish when somebody comes in with debilitating pain, and oftentimes they're crying or very upset, and they can barely get on and off the exam room table, and see them come to the end of treatment where they're happy and smiling, and perhaps they come in with a thank you card or a box of chocolates for the office staff. It really makes the years of effort and schooling worth it to see patients go home with a smile on their face.